Okay, so let's have a look at some exercises, some strengthening and some stretch which can help you manage knee pain. So as I mentioned in one of my other videos, the most important thing to do is, if you haven't got any swelling, and it's very different, if you've got swelling around the area, then we would encourage RICE, which is rest, ice, compression and elevate. But in general, for knee pathology, it's keeping it moving, it's keeping that flow, which is what we want to encourage. So we know that gentle marching and walking, going out if you have that, and even if you were to go out for short bursts of time, if you can't do long walks, and I wouldn't encourage, if you're suffering with knee pain, to do that. You know, try to look at having a short distance, feel where the pain is around the knee. That will give a good indication, especially if you're looking for some advice, then you can feed that back to your therapist. So, ones that we commonly use, and I'm going to give you a couple of options. You can do ones that are laying down and also ones where you're seated. So, when it comes to sitting, just take that down a little bit for you. So, when it comes down to a seated position, one of the things that we would be looking at is to try to strengthen the quadricep and balance the hamstring. It's a very simple exercise of where you would take the foot out, and what you would do is you would flex that foot so you can feel this muscle tightening. It's all about tightening the quadricep, and then release. Again, having good posture, pulling in, being upright, nice and tall, but taking that leg out, pushing down so that you can feel that tighten and release. And I would do that for about 5 times, because we're starting off. There's no point in trying to do too many reps. When you've got an injury, it needs time to heal, but we also want to keep the strength in that muscle. So, take the leg out, flex, and what we're doing is we're flexing the foot, and you will feel that muscle tighten, and then release. So 5 times to start off with, and I always encourage people to do it on both sides. Always look at balancing. So even though I might have right knee pain, try to do them on the other side, because what will also happen during that period of time, you will have been overcompensating. So you would have been placing more weight on one side, which would have caused potentially another problem. So if we balance it, we know that we're giving the body the best possible chance to heal itself. The other thing that we would also look at, you place a cushion in between the knees, and we want to strengthen and start to work the adductor muscles. So add together, abductors away. It's just the name of the group of muscles. So either placing a pillow, for example, just in between the knees, squeezing and release, squeeze and release, squeeze, release, squeeze, release. All we're doing is we're activating the muscles. We're starting to get them to work and starting to tighten up the muscle. Okay. The other thing that we would look at doing is we would want to start to stretch as well as strengthen. So if you're able to, when you stand up, I would encourage you to do a hamstring stretch while standing. So you bend one leg, pulling in, always engaging if you can in the core, taking the leg out in front, bringing the chest towards the knee and stretching. The aim is you're stretching out the back of the hamstring, because we're looking at, as in the other video, trying to free up the muscles and the tendon attachments. Would hold that for a good, I'd say 20 seconds at least, and then repeating that onto the other side. The other one that's really good, and you can do this if you on a step, or if you have a secure box or a footstool, is, or if your balance is good, hold on to 2 chairs if you need to. What I want you to do is take the weight and place it onto the leg, okay, where you have the knee pain. Soften the knee, and with your foot, just take that foot away from the floor and bend. So what I'm doing, I'm putting a bit of compression loading, but it's important to, again, make sure that you're pulling up, lengthened from the core, from the abdominals, so that you're not putting all the weight on it. What we're doing is we're safely strengthening those muscles. So just a little bit of weight, and then coming up. So it's what we call a little dip. And again, 5, and you would do them nice and slow. The key is, with all strengthening or stretching, is listen to your body. You'll know if it feels too much, then just rest the other foot on the floor, and then just gently place that weight onto that foot so that you're feeling it start to work around the knee. So we've worked the inner thighs, we've looked at a little bit of strengthening on the quadricep. Now if you wanted to, and some people prefer this, you have another option of strengthening your quadricep, which is by sitting on the floor, okay? You pull nice and upright. Sometimes if you feel that it's too much, you can always place your back against the wall. You take the leg down, you flex that foot, and you lift, and then release. You lift, and then release. And you would do that again about 5 times. This is just activating the muscle groups. We're not going into definition building. This is if you have a specific injury. And again, you would always repeat that on the other side. Now, there's different ways of stretching out the quadricep, and if you have knee pain, you may find it difficult to do what we call a quadricep stretch, which is taking the foot behind the knee, bending the knee to stretch that out. Sometimes if you have knee pain, that can feel almost that it's causing too much damage. And without actually seeing a client to ascertain exactly what kind of stretch would be beneficial, if you do that stretch and you don't feel any discomfort and you feel a stretch and you benefit, it's very much listen to your body. Another one that can be used is if you're able to put the pressure on the knees, is just to lean back slightly. You can bring the arms out just to stretch. But if your pain is right under the centre of the kneecap, again, that might feel too uncomfortable. You have another option of sitting on the side, bringing the leg forward and taking the leg back so you can feel a little bit of a stretch. So you're almost kind of pulling that leg back. Now there are, as you'll see in some classes, that they may take the leg all the way back. Providing you haven't got any pain, you can take it into a bit of deeper stretch. But for every strengthen, we need to stretch. The other thing that I encourage is what I call percussion or tachypotment, and that is just bringing in a little bit of friction to the area and also just a little bit of a rub so that you can then increase that blood flow and help to stretch. Jazz pliés are one of the most effective exercises that I've come across to help with knee. And what they do is it's because it works all of the muscles in the leg. And it's quite easy to do, but again, you would take it nice and slow. So, what is a jazz plié? So, we take, let's take that away. So, we take the legs out, we pull in and engage. We bend the knees. Now you can use a chair again for support, and then I'll just lift my trousers up, take the heels away, come up, and then bring the heels down. And then we reverse that. You will come up, bend, come up and down. And then with feet parallel, bend, lift the heels up, come up nice and tall and down. And then your other option is with the heels together. You will bend, heels up, rise up and down, and up and bend, rise up and down. And always have a good shake out of the muscles afterwards. So with those few basic exercises, we can start the process of mobilising and getting the knee back to an area where decreasing the pain, helping to relieve, increasing blood flow. Now when we go on to the next stage, then you would look at strengthening a little bit more intense. So that's resistant bands, where you can hook under the foot, and then we can do some assisted stretches. We've looked at the cushion squeeze, which we call it. We've looked at strengthening. The jazz pliés, the reason why I advise those is because they work every muscle group just by changing the position of the feet. But you always want to balance it, because the weakness might be coming from the hip. So that's when we would go on to band work, where you would look at placing the band under the foot and taking the leg away and down, taking the leg away and down. But again, that would come further on after you've just established, a basic exercise routine. I would encourage you to do these at least 3 times a day if you can. That way you're getting the leg ready. You may find by even just doing those exercises and a bit of self-treatment that it was a pulled muscle, it's tight and it's healed itself. If it hasn't, then that's when we would do a little bit more intervention. But hopefully you found that useful, and I will say be back. We're talking about some other pathologies and how you can help treat them yourself. Okay, take care.